Hi, I'm John Tucker, CEO for Mount San Rafael Hospital and Clinics. I'm delighted to share a virtual tour of the latest and largest project ever for our community hospital. I wish I could give this tour in person, but with the constraints of social distancing during these uncertain times, we thought this would be a creative way to introduce our completed facility renovation project. On behalf of myself and the Trinidad Area Health Association Board of Trustees, we cannot say enough about our enthusiasm for this project, how grateful we are that it has come together, and how much we look forward to it benefiting the citizens of our community. So come along and let's get started.
As with most things in beautiful Trinidad, Colorado, our community hospital is steeped in a rich history. Mount San Rafael Hospital began its long journey of serving patients back in the 1880s. The hospital was completed by the summer of 1889 and included 40 beds for patients. In 1968, after 80 years of service to the patients and the community, the Sisters of Charity made a difficult decision to close the hospital. A group of citizens joined together and formed a non-profit organization which they named the Trinidad Area Health Association. Over almost the last 50 years, the Trinidad Area Health Association, along with the dedicated staff of highly trained professionals at Mount San Rafael Hospital, have continued the mission and groundwork laid by their forefathers to meet the ever-changing and growing healthcare needs of our community and ensure we have adequate space and equipment to provide the highest quality patient care. We embarked on our first facility renovation project. This multi-phase expansion and modernization plan of approximately 31,000 square feet replaces the majority of the patient care spaces at the hospital. This two-story building has an emergency department, imaging center, and medical surgical unit, which includes an infusion center. This renovation ensures that high-quality healthcare remains close to home. And it allows the services offered to our community not only to survive, but thrive for many years to come.
Let's begin our tour of the emergency department. The public entrance at the front of the hospital is for patients and families arriving for care. There is a separate entrance on the side of the new building for ambulance and emergency vehicles. As patients enter the ER, there is a beautiful waiting area for family and 2 registration areas built for patient privacy. The biggest element to this new ER is the fact that it has double the number of patient rooms than our old emergency department. The rooms are designed for the severity of injuries and the condition of the patient. Some of the rooms include the Inova Emergency Medical Associates Triage Room, where the patient is assessed once they arrive, to a consultation room for the medical team to meet with family members. As anyone who has visited our ER knows, space was limited for both patients and practitioners. But now you can see each room has plenty of space for everyone involved in working through an emergency or trauma situation. We've also worked really hard to ensure that frequently used services are closer together and laid out in such a way that makes it easier to transport patients between services like the ER and radiology with minimal disruption to patient care. The imaging center now has all the services in one location. The new location for radiology is a big deal for us, and we now have all the radiology services consolidated to one area. This new area includes X-ray, nuclear medicine, CT scanner, ultrasound, digital mammography, bone density, and MRI all in one location, and they're all in close proximity to the emergency department. The second floor is the medical surgical inpatient unit. We are so proud of how this project has come together, and we are excited for our patients to reap the benefits of this new space. You can see we have an accessible central nurses station where families can visit with our nursing team to find a patient room or be directed for other services. All patient rooms are clearly visible as you look down either hallway of the nurses station. We have all private rooms on this floor, all equipped with a private shower and bathroom and ample seating to accommodate visiting family members. Each room is also equipped with electronic whiteboards, which allows our nursing team to ensure patient data is up to date, all within a few clicks of a button. The boards also provide important patient care information, checklists, and hospital details important for patients during their stay. Also on the second floor is the addition of the Edward and Karen Griego Infusion Suite, which has 3 infusion and treatment chairs. As part of our new space, we have created this suite where individuals requiring infusions or limited special treatments have their own personal space to complete this process. We will soon be administering chemotherapy in the new infusion suite.
Thank you so much for joining me on this bit of history and virtual tour of Mount San Rafael Hospital's new building and in celebrating this tremendous new addition to your community hospital. We are so proud of this achievement, but more importantly, we are thrilled to make it available to the benefit of our citizens and in service to our community. I want to thank the community as well, and all those whose contributions made this dream we had become our new reality. Your gifts provided for this permanent legacy on healthcare in our community, and we couldn't be more grateful.